right, welcome to Deuk Spine Institute live stream of Deuk Plasma Rhizotomy Lumbar Spine. Our patient presents to us from New York. Move your hand, shot. And he had just completed his Deuk laser disc repair surgery on his discs. We're now going to be repairing his facet joints. He has facet joint pain. And the first, Jordan, will you help us show the audience the first facet joint we're going after? That is, show us the joint. Yep, that's the joint. It's the right L2-3. Show us the joint. Yep, right there. And now, shot. You can see the tip of our probe is right at the junction of the transverse process and superior articular facet. That is literally where the medial branch of the dorsal ramus lives. And that's why we're over here. We're going to destroy that pain nerve. It literally lives right here. Shot? It's the same target for a rhizotomy that's done with radiofrequency ablation. However, the difference is this treatment actually is permanent. All right. That's one down. Nope, don't do that. We're going to go on to the next one, which will be the right L3 TP. Shot. Too low. Any questions? So we're aiming again for the same landmark at the next one, which is, Jordan, you want to show the audience? Right above where my probe is, right there. Yeah, maybe a little bit medial, but that's the gist of it. I'm on it right now. I can feel the bone. Shot. All right, too medial. I need to be a little more lateral. Perfect shot. And that's, see where the tip is right there? Show us the tip. Circle it. That is literally the most perfect place you could possibly be for this procedure. It's along the transverse process. And there's a little nerve there called the medial branch of the dorsal ramus. And that little nerve is carrying pain information. Anybody see the movie Sucker Punch?
I did.
You did?
I loved
Who
it.
said that?
Me, Henry.
Henry, right? One of the best movies ever made. Really, one of the best movies ever made. I'm not kidding. It really is. I mean,
It's very, very underrated. People,
ridiculous.
yeah, it's not talked about as much as it should.
So in that movie, shot, there was this scene where this, it's one of the scenes is in Nazi Germany, and there's a Nazi soldier, and his job is to take the map from the command post and get it on board get it back to headquarters in Germany, on board this giant inflatable balloon. Just like the, what was it called, the Zephyr? The Hindenburg. Anybody know the Hindenburg story? Oh my gosh, the Hindenburg. The Germans used these helium or hydrogen blimps that would float around the battlefield, and they would kill people below them on that. Anyway, this young officer's job was to take the map from the command post up to this Zephyr, which is like the Hindenburg. And the job of the girls, which are the protagonists of the movie, their job was to stop him so the map doesn't reach the headquarters, basically to help people from dying. They had to stop the map from getting to the headquarters in Nazi Germany. So what did they do? They went in and they attacked the headquarters, trying to stop the map guy from getting the map to the blimp. Right? You remember that scene? Henry?
I apologize. Repeat that.
Oh. Yeah, one of the scenes was they were trying to block the transmission of information,
Yes.
the map.
Yes.
Right? To get to the Zephyr, to get to the blimp.
Yes.
which will then make its way back. So that's what this procedure is, okay? Of course, I'm not as good looking as some of the ladies in the movie, but I'm stopping the transmission of pain signals from this arthritic joint from going up to basically command central, the brain, the pain centers of the brain. That's the whole purpose of a rhizotomy, is to deaden the pain nerves that transmit pain signals. So I'm kind of like them, trying to stop the transmission of information that will be used for bad purposes, right? All right. Well, I like the analogy. All right, we're done with this one. I've got 2 more to go. I'm going to make another little incision on this side, and then we're going to go. I do need another tip. All right, so while you're doing that, I'm going to inject some medicine so our patient remains comfortable. Now, that whole procedure you just watched is done through a 3mm incision. Jordan, let's show the audience the incision. Move the fluoro out for a second. Henry, take a look here. This is still sterile.
Yes.
You see that? Right here.
Yes, we do.
Give me a ruler. Sorry, those are inches. Folks, with this 3mm incision, we're able to, 3mm, we're able to go in and destroy the pain nerve to three spots. We're going to do another incision. We're going to get 2 more spots, for a total of 5 spots on the right side, treating 4 joints. All right, let's bring the fluoro back in. The fluoro being the X-ray machine. For those of you who don't know, we use X-rays to guide our treatments in spine surgery. That's universally what every spine surgeon does. We all use X-rays. That's good. All right, so you can see I'm a little more medial than I want to be, but we're right over the L5 transverse process shot. That's perfect. All right, be a little bit more lateral, but this is good. Das ist gut. Any questions?
No current questions.
Now, we've been doing this Deuk plasma rhizotomy procedure now for, about 1.5 years, huh, Luis? And we've done, I don't know. I don't have the numbers in front of me, but well over 200 of them. At this point, we've had really good results. We've had, I think, 1 patient came back because they had really bad arthritis from the fusion they had done before, and we went in and did the DPR in 6 spots, and all of them worked except for 1. I had to go back and redo it, and of course it worked. But we had one facet failure in that patient. But other than that, every other one has worked to get rid of the pain. Shot? All right, still a little bit. A little too medial. He's got some really big bones back here. I'm bouncing on his fascia. Can feel the arthritis. Shot? All right, so that's not too bad. Jordan? I could feel the TP.
Right next to the ground.
Now what happens is when I hit the power on this thing, a lot of times the muscles will contract. We're fine. Shot? But you got to be careful with the muscle contractions because...
We have the other side of you, right?
Yeah. Yeah, but just 2. So far, so good. Shot? That's about the most perfect spot right there for his procedure. Shot? So, show us the TP, Jordan. So you can see I'm right over the pedicle. The TP is, no. Yeah, all right, there we go. Yep, perfect. Oh. And you want to be really where the transverse process meets the pedicle. But you got to jump around a little bit. You can't just stay in one spot. You'll never get the whole nerve. You got to move it around. Shot? All right, now I'm going for the bottom spot, which is right where the S1 facet curves down and laterally. I'm a little too far south. Shot? Still too far south. Shot? Oh, a little too lateral, but not horrible. Shot? Let's see where that is. Too south. Shot? Any other questions?
Yes, we have a question from Joyrider on YouTube.
Joyrider, nice.
And they ask, hello, Doc. I was diagnosed with spinal stenosis.
Mm-hmm.
Do you perform surgery for spinal stenosis?
We do. We just did. Spinal stenosis means narrowing of the spine. And spinal stenosis, contrary to popular belief, never causes back pain. It only causes basically leg to go weak or numb. So if you have leg weakness and numbness, then that would be something treatable with spinal stenosis. What do you think, Jordan? You think that's it?
That is it.
Huh. I think it's further down. There, yeah. Well, because I'm looking at where the facet arises from. We may need one more of these. Shot? May need one more. Yeah, to me that looks more like where it would be. Shot? I think that's it. That's it for this side. Don't open it. You're funny. Okay. I'm going to switch. Actually, I could probably do it from this side. So I'm just going to go to the other side, and we're going to do the last two facet joints. Sorry, Luis. That was funny. All right. Joyrider, thanks for asking. But spinal stenosis never causes back pain. Spinal stenosis only causes leg symptoms. And if you're having just leg symptoms and they get worse with standing and walking and get better when you're sitting down, then perhaps you need spinal stenosis surgery, which is fine. Yes, we can do that with this procedure. This treats spinal stenosis. Is this needle the same as the other side? Oh, that's amazing, because this side is rotated away so much. Shot? What do you think, Jordan? It looks like I'm in the right spot. Yeah, wow. Very interesting. Shot? I'm on the bone right now, and the fact is that I have this needle completely sunk down. Here, take this. That's because the spine is rotated in scoliosis kind of rotation away from the left side and towards the right side. Which is going to suck when I get down to the sacrum. Here? All right. Just a few more minutes here on this procedure and we'll be done. You have the last Bovie ready?
Yes, it's ready.
I'll use this for a second. Let me do this for one and then we'll go to that one. Keep the questions coming. We're almost finished here. But This is a Deuk plasma rhizotomy. And you guessed it, it's only done at Deuk Spine. That's where it was pioneered. But it is a permanent rhizotomy. Instead of the RFA procedure you all hear about that is temporary. This one lasts. We used to do just the temporary ones, but we got tired of people coming back. Yeah. Sean? I started asking, why are they coming back to Dr. Patel? And he says, because the procedure never really fixes it. And I said, why not? In theory, it makes sense. Should fix it. Right? Yeah, man, this side is super deep. Shot? It's too low. Give me a second here. Shot? That's too high. Somewhere in between those two. Right there feels good. I'm right on the bone. You always want to be on the bone, but I'm too lateral. So I want to be a bit more medial on the bone. Uh-huh. Yeah. It's very important you pay attention not just to the x-ray, but you have to pay attention to your hands. That's the perfect spot. You have to feel the bone, folks. And this has a short TP. All right. Let's just put the last one on. All right. Very good. We've got 2 more burns and we're done. Any more questions?
But, yes, we have a question. This comes from C. Wang on YouTube.
Shot.
And they ask, I am diagnosed with compressive disc bulges at L4-5. Can you treat that? And also with facet syndrome at the lumbar?
Yes, we can. Absolutely. We can actually eliminate your pain. If you come here to Deuk Spine, we can help you. We can get rid of the back pain from those bulges. We can treat it with the Deuk laser disc repair, the surgery that we just performed prior to this one. Shot? What do you think, Jordan? Think it's a little higher? I mean, I feel bone right here. I'm feeling like the mammillary process. But yes, we can fix you. Just submit your MRI so I can review it with you. Shot? And I'll tell you exactly what needs to be done to fix your problem. This side is a bit abnormal. No, there's a lot of arthritis, but you know, the scoliosis has shifted everything anteriorly. All right, that's the best I can do. Look at that. May have to go back to the other one. Shot. Last one. Shot. Almost done here. I'm on the bone. Shot. Too deep. Too inferior. I mean, not deep, but inferior. Need to go more towards the head.
We have one more question.
Shot.
This comes from Ali, once more on Facebook. They ask, if you would get rid of the pain nerve, would that area still have inflammation without the pain and with the swelling?
Yes, that is correct. We're not fixing arthritis. Nobody can fix arthritis. We're fixing the symptoms of arthritis, the pain. That's really the best we can do. There's nobody that can fix anything more than eliminate pain and restore movement. That is the goal of surgeries. There's no cure to arthritis. Great job, everyone. We're done. Henry, you can end the broadcast. Thank you.
Copy that.